Talk about the big day today. Yes, it's been 1 year since lockdown was first imposed all across India. At that time, it was unprecedented how strict this lockdown was. Of course, over the next 1 year, we saw several countries experimenting with different formulas and different versions and variations of lockdown. The purpose then was to get India ready and India's medical infrastructure ready to deal with COVID-19. Was it successful? Could it have been done better? Was it actually needed? Well, the jury is still out, though a lot of experts do believe that at that point, with the information we had then, there was really no other choice. Today, if we can feel proud of the fact that relatively our mortality rate is low. Yes, infections have been high, but relatively fewer people have died of COVID-19. Well, perhaps the lockdown is one reason for it. The question is, what happens now?
There are fears of rapidly spreading virus.
This is a rapidly emerging situation.
We now have a name for the disease, and it is COVID-19.
Today I am officially declaring a national emergency.
We must therefore go into a national lockdown. This is the worst public health crisis for a generation.
Scientists have been working frantically to try to stop the deadly illness, and it's
trying to develop a vaccine for the virus.
India's post-corona unlocking begins in its first clear message that the lockdown is going to end.
आज भारत एक नहीं बल्कि 2 मेड इन इंडिया कोरोना वैक्सीन के साथ मानवता की सुरक्षा के लिए तैयार है.
Professor K. Srinath Reddy, President of PHFI, with us on the show. Sangita Reddy, Joint MD of Apollo Hospitals, with us on the show today, as is Dr. Arvinder Soin, Chairman of the Medanta Liver Institute. Welcome to all of you, and thank you so much for speaking with us. Professor Reddy, I want to start by just getting your take on what is this double mutant variation, which we have heard of from today. The health ministry saying that there has been a huge expansion in this particular kind of variation. It was found in Nagpur, Maharashtra in December last year, has now spread to 18 states. Is this something now to be concerned about? And from the information that is currently available, could this be responsible for the fresh surge in cases?
Well, they have been informing us from the health ministry that there have been mutants that have been found, which have actually been traced to the British origin mutant, to the South African origin mutant, and even the Brazilian origin mutant. But at the same time, we know that there have been some mutants that have actually been found, which appear to be of Indian origin, and they have been tracked as well. So it does appear that there is a combination of several mutants, which is now responsible for the rise in cases with increased infectivity. They're still investigating to what level this is responsible for the rise in cases, because the total numbers of cases with these mutants are still not very high. But it stands to reason that many people who are asymptomatic or mildly symptomatic might not have been investigated in terms of genomic screening or even original testing. So unless an extensive genomic screening is done on most of the cases who have been identified afresh, and particularly if there are any repeat infections, then they must be investigated even more thoroughly. And that is where we must find out what the level of threat that is posed by these mutants is. But so far it does appear, from whatever is being told by the physicians in Mumbai, that while the infectivity has risen, it does not appear to pose a major threat in terms of increased virulence. And that is a relieving feature, though even if it maintains the same level of virulence and the total number of cases go up, the total number of serious cases and requiring hospitalization and deaths will rise even if the fraction remains the same, but the total count increases. But it's also possible that the mutant might have actually become less virulent as well. We'll have to study the behavior. But both the original wild virus as well as the mutant strains require the same level of public health precautions that we must follow, and with even greater vigor. And of course, these must be investigated as quickly as possible, and contact tracing also must be done vigorously to find out who has been infected with some of these mutant strains.
Absolutely. Sangita Reddy, a year later, and it's really unusual kind of a situation, because when we had planned this show, we thought we would talk about the way forward. We thought we would talk about the progress that we've made. But the fact is that a year later, we are facing many similar challenges, both in the medical industry, as far as medical infrastructure goes, as well as for industry as a whole. How do you look at the current situation?
So, Tamanna, you're absolutely right. I think over the last year, we've interacted many times. We've been through the process from the announcement of the lockdown to the appreciation of the troubles of the lockdown. We saw India as a country fight truly well. Whether it was society at large, it was our scientists, our doctors, our government, the business houses. We saw industries step up, whether it was in the manufacturing of PPEs or managing to keep most people at work. And from its peak in June, July, to the number of cases, being under control, hospitals gearing up, our protocols of treatment improved, the death rates came down. India was beginning to be acknowledged as one of the countries that has truly handled the vaccine, the entire COVID well. And then we had the hope on the horizon of the vaccine. The new year began with tremendous hope. Not only were our cases among the lowest recorded in January, February, but then the vaccine rollout happened. So you're absolutely right, everything was looking good. And in the midst of all that, the economy not only rebounded, but the projections were, and various agencies came out with the estimates. IMF said it, this was also echoed by multiple other global agencies, that India would be among the fastest growing economies in the world in the coming year. So in the light of all that, this so-called potential second wave is something that has definitely thrown us off here. However, I think as a country, a nation, and a people who have fought well over the last year, we have built the resilience, the knowledge, and the capability to fight again. And it's important for us. I think two critical things stand out. Number one, rapid mass vaccination. Forget all vaccine hesitancy, roll out as fast as possible to all age groups. And number two, please go back to strictly adhering to the behavior that we learned over last year, which is COVID-appropriate behavior, SMS, sanitize, mask, social distancing. We have to do these two things. We are truly at the brink of a turnaround moment, and we shouldn't let us slip into, once again, a difficult scenario. That's truly how I see the situation that we're in now, Tamanna. And we've interacted with you many times over the year. Let's hope that we very quickly turn this situation around.
Absolutely. And this is why I was keen to speak to this panel today, because we've actually sort of been on this journey together to figure out what's happening. Just to speak about the mass vaccinations, news coming in today as per reports that India is mulling curbs of exports of the AstraZeneca vaccine, which SII, Serum Institute of India, is making here in light of the new cases. We all know that from 1st of April, all of those above 45 can be vaccinated as well. We've spoken many times about how this needs to be expanded. Dr. Soin, my question for you, and of course you'll speak about your journey over the last 1 year. My question for you is, are we really any clearer about what's going on 1 year later? Today, there is still so much of misinformation or mixed up information. Will vaccines tackle new variants? We don't know for sure. Can you get COVID once again after being vaccinated? There are mixed reports about that as well. Is it only social distancing and masking that can help you, save you? We don't know for sure because cases have spiked even when people are being careful. What are the cures going forward? How long this will last? Do you think that sometimes as a medical professional that bit of fog is a bit frustrating?
So I'm going to be very optimistic compared to what you sounded in your last minute or so. I think we are far better off now than we were last year. In terms of knowledge, in terms of science, we've made definite strides. At this time last year, we were totally at sea on how to treat this. We went into lockdown, not just to gear up our healthcare, but also because we were scared of passing infection to each other and people wanted to stay indoors. So lockdown was for both these reasons. But as I see it, the most important effect of the lockdown seems to have been that our healthcare systems have got geared up. So we are better off both on the private and public fronts in terms of treating patients and gearing up for not just treatment, but also vaccination. So in that sense, lockdowns have done us good, but I don't think lockdowns are a solution anymore. In terms of treatment, yes, thousands of us, not just in India, but all across the world, we undertook scientific trials. And many of us, including our group, have published the results of the trials we undertook. And we understand treatment of the virus much better. The mortality has gone down from about 1.5 to 2% in India last year to just under 0.5% now. And the mortality has fallen all across the world. So we do understand how to treat the virus better. I think that in terms of the steps ahead, the most important and effective arsenal we have today is vaccinate everyone, like Sangita has already said, like I have said many times on Twitter and on your program. We should not just restrict it to 45 and above. We should actually vaccinate all adults. And the only reason we think we're not rolling it out to every adult is perhaps because there's a vaccine shortage. I have no idea what the vaccine stocks are with the government or with the manufacturers, but what I would have thought is that you open this up quickly to everyone, all adults, and there will be other vaccines coming through. I believe we have a dense pipeline of vaccines in India, like the Sputnik, like the Novavax, for which about 1 billion doses have been promised, like the Zydus. So all these should be on the horizon in the next couple of months. And I'm sure our stocks will last out until then, and we should open it out to everyone. And, you know, the other thing is that just stressing on what Dr. Reddy just said, things like Kumbh Ka Mela and, you know, congregations for religious and festival purposes are an absolute no-no. They're going to be disasters in terms of being super spreader events. We have to avoid those at all costs. The other thing is that, you know, you must understand
that's the point.
More than 70% of India is less than.
Yeah, you know, Dr. Soin, that's exactly the point. When I say that things are unclear, that's exactly what I mean. We're still 1 year later. We have these double standards. In some sense of hypocrisy, where it's okay to have large crowds at election rallies. You spoke about events like the Kumbh Ka Mela. And on the other hand, we're cracking down very clearly on things like restaurants and malls, which we must do. But there should be clarity in what we're doing, and it should be applicable to all.
Yeah, I agree with that. You know, Tamanna, you know, sitting at the helm of this happening in a country of 1.4 billion people is not an easy job to manage. So, you know, I'm not going to criticize the government here and saying that they haven't done a good job. They've actually done a fabulous job. And they're absolutely right in rolling it out to people more than 45, because 80% of the people who die from COVID are more than 45 years of age. So there's nothing wrong there. But I think that you also have to understand that more than 70% of India is less than 35 years of age. So unless you roll it out to all adults, you're not going to get to that magical figure of 60 or 70% herd immunity. It's not going to happen for 2 or 3 years. So, you know, we really have to roll out the vaccines fast. That's what I would say.
Absolutely. Dr. Reddy, can you give me an idea of how you think our vaccination program can move forward at a quicker pace? Is it now imperative that we have more candidates ahead to really widen the scope? Because we keep going round in circles on this, that you vaccinate everybody. And do you think there is enough evidence now globally to show that quick vaccination will actually bring down infections quickly enough?
Well, the best evidence we have is from Israel, where the huge amount of vaccination that has taken place seems to have really curbed the transmission rates as well, apart from protecting vulnerable people against severe infection. But we do not still have full data from elsewhere in the world. And as of now, whether it is the vaccine companies or the WHO, they keep insisting that the evidence is available about protection against severe infection, but not necessarily that against severe disease, but not necessarily against the infection per se. But even if it can prevent against severe disease, then it would have an effect on the transmission rates, because people who are sicker are likely to be discharging more virus particles with much greater viral load into the environment and infecting more other people. But since the evidence right now, which is concrete, is that severe infection and deaths are prevented by these viruses, by these vaccines, we ought to try and prioritize people who are performing essential functions as well as people who are vulnerable. I'm glad that these categories are being redefined, because definitely many adults are vulnerable, and there are many categories of essential workers, including school teachers and personnel, who are to be considered as essential. But while we are expanding these categories, and ideally we must cover as many of the adults as possible, which I agree, we have to try and remember that our vaccine stocks, which are available, and hopefully the ones that will become available soon with additional vaccine coming in, are partly dependent on our manufacturing capacity, but that manufacturing capacity could be somewhat constrained by the fact that some of the important raw materials that are required, including some sort of tubes and other ingredients, are now becoming difficult to obtain from the United States because of the Defense Production Act, which was invoked in the United States, essentially to give a fillip to their own domestic industry for vaccines, personal protection equipment, and ventilators. But that also has the consequence that many of these ancillary elements, which are the raw materials, are also prevented from getting exported to India. So while the Indian manufacturing capacity can certainly expand and can produce a fair amount of vaccines for India as well as for the rest of the world, some of these constraints need to be removed urgently. Otherwise, despite all the promise of multiple vaccines at high volume, we may still find ourselves in shortage. And I think that is why a fair amount of planning is being done as to how the vulnerable groups are being protected first. And then as more become available, they'll get expanded to other age groups as well.
Absolutely. You know, the point about vaccine nationalism is one which we will possibly see unfolding in the months to come, where countries are going to start getting territorial and making sure that they have their populations covered first. Maybe excess supplies will be hoarded, will be stored, and that will also be very unfortunate. Ms. Sangita Reddy, from the perspective of industry as well, do you think that the big differentiator this time around is that there's no imminent threat of a complete tight lockdown being implemented again? That has been made fairly clear. There could be localized restrictions being put in place, but that sort of grinding halt of supply chains, of manpower will not happen again in all probability. Does that give you confidence as a business leader?
So definitely, Tamanna, I think it's well acknowledged that while there was a protection to lives during the lockdown, and I think there's a wonderful study from IIT Hyderabad, which said that if we did not have the lockdown, we would have had upward of 25 lakh cases, and the scenario would have been very different. So considering that, I think we were thankful for that lockdown, but also very clear that besides lives, the ones that were most affected were livelihoods. India cannot afford another lockdown. And better still is the fact that we probably do not need another complete lockdown. What we need is a different approach, which has evolved over the months of learning and working together. And that is that we know how to treat the vaccine. We know how to treat the virus. We know how to prevent the virus through the vaccine. We know how to control the virus, and therefore we should implement those methods. And we just have to keep ramping up steadily and continuously. So very clearly, no complete lockdown, areas of tight restriction, greater control across ecosystem, greater restraint among public, and moving forward towards the vaccine. That's the mantra that all of us are talking about.
Absolutely. You know, as we look over the last 1 year, I think without exception, it's been a time of accelerated learning for everyone in every field and possibly in every scope of their life. When people decided that they had to figure out how to do things differently to survive, whether in the professional sphere, whether it is balancing things, whether it is better management of your time and the technology. So I just want to wrap up by asking all of you, let me start with you, Dr. Soin, what your biggest learning has been in the last 1 year?
I always say to people, one has learned what one can live without. One has learned what one can not live without. And one has learned what one must live without, you know. So it's basically, and one has embraced the digital world in a big way. So both in medicine and, you know, even in meetings and even socializing, you've actually been connected with your friends and family much more on the digital front than in person. So like you said, we have realigned our lives, and we've learned to connect better with nature. We've learned to connect better with ourselves, with our family and the close family, and spending time at home with your family has been one of the big boons of the lockdown, if you can say that there is any boon at all. So I think that we have realigned ourselves and our thinking in a big way, and some of it for the better, for sure.
Absolutely. I've run out of time. And I want to, with that, thank all of you for joining us on the show this evening. I want to thank you, Sangita Reddy, Professor Reddy, Dr. Soin, for being with us through this journey, and so many more medical experts from every field, actually, experts that we've spoken to. This journey continues. And hopefully on the other side of it, we will have some return to normalcy, that ever elusive normalcy. Thank you so much to all of you for joining us today.